out now. Because somebody's like, why is there 11? All right. So finishing up, our last unit's going to be on still the nervous system, focusing a little bit more on the brain. And this is kind of a weird unit in that there are so many complex things that go on with the brain, like what to go over, what not to go over, what not to get into. So it sometimes feels a little choppy, just to kind of warn you. So, come on. The brain. We're going to learn about the neuroglial cells in and around the brain, part of the central nervous system. The brain has connective tissues that wrap around it that you guys have probably heard of, known as the meninges. Okay? We've seen some of these things already before because we've done part of the central nervous system in the spinal cord. There's going to be chambers in the brain known as ventricles, and these chambers are going to be filled with cerebral spinal fluid that oftentimes gets abbreviated as CSF. Okay? Do we remember we had 2 neuroglial cells in the last unit that were in the peripheral nervous system? Remember what they were? Schwann cells, and then the one that really didn't do it, kind of like, well, I'm not really sure what they do. You give it an S. You're close. You're on the right. Satellite cells, right? Okay, Schwann cells and satellite cells. Good. And the one big thing that we made a distinction about, neuroglial cells don't conduct, okay? Neurons conduct, neuroglial cells don't. They do other things, and we'll see here what they do. So the first one is called an oligodendrocyte. It's most like a Schwann cell, just in the central nervous system. So if I tell you that, then we can probably guess it's going to do what? What's its function? Not conduct. Myelinate. Yeah, myelinate the axons in the central nervous system. Okay? So still not a conducting cell, but it myelinates axons. How it's different than a Schwann cell was one Schwann cell equaled one myelin sheath in the PNS. Okay? One oligodendrocyte, they kind of describe them looking like an octopus, where they have arms, and each arm wraps around a part of the axon, forming a myelin sheath. So one oligodendrocyte might form 10, 15, 20 myelin sheaths on different axons in different locations. Okay? Now, because of that, too, think of it kind of like an octopus with its head and its brain, okay? And the arms are what's wrapping around there. The Schwann cell, we wrapped it around there like the toothpaste, and the toothpaste, the cytoplasm and the cell nucleus got pushed up to the top, and that enabled it to form the neural lemma. The neural lemma was necessary to heal the axon, regenerate the axon, right? These oligodendrocytes don't have that same setup, so that's why spinal injuries in the CNS are more devastating than in the PNS, because they don't have the ability to regenerate, okay? Science wants to take stem cells, poke them and prod them, and try to get them to to differentiate into neurons, to try to help that, but so far, I don't want to say it's not working, but it's nowhere close to working just yet. So oligodendrocytes form myelin sheath. Each arm or process wraps around a portion of the axon, making a myelin sheath. So one oligodendrocyte can form many myelin sheaths. And then it does the same thing. It insulates the axon. It speeds up conduction. Okay, so there's nothing really new to learn with that. The next one is called an astrocyte. Astrocytes, astro means star, so they kind of think they look star-like. I don't know that that's really the case. But each tip of the star, they refer to as kind of like feet. And that foot grabs on to neurons and different things there and wraps around there. And it kind of helps hold things together. So the other thing it does is its feet wrap around blood vessels. So where the oligodendrocytes, its arms wrap around the axons and myelinate them, these feet wrap around blood vessels, especially capillaries in the brain area. 202 is when you're going to talk a little bit more about capillaries, but essentially what a capillary is, it's a very thin, small vessel where you have exchange of nutrients, okay? And it does this because it's got little holes in it. Think of it as, I don't even know if they do them out here because they probably melt, but like the Midwest, they've got those flat garden hoses with lots of holes in them, and they put them out to water their yard, and kids run through them. Think of it kind of like that. So as long as whatever is small enough to fit through the holes, it can move in and out, okay? And it does that through diffusion. Well, if we take these feet and we wrap it around the hose, now if we had, and I don't have any props to show you, but if I had a strip here and I had a hole this big, but then I wrap my hands around it, I just cut the diameter of that hole down, right? It's only now whatever the space is, like say between my fingers. So it seals off those capillaries. And these astrocytes, they do this in the brain, and that's what forms, you probably heard of this term, blood-brain barrier. Okay? So they form the blood-brain barrier, and this helps restrict what would normally be able to go in and out of capillaries to a much smaller amount of things that are allowed to. And it's a way of protecting the brain. We don't want things to have easy access to the brain because that could be very problematic. They're the most abundant neuroglial cells, and I don't know, anyway. If I told you this, neuroglial cells outnumber neurons like 50 to 1, okay? So astrocytes being the most abundant neuroglial cell means it's the most abundant cell in the central nervous system. Astrocytes, when we damage a neuron in the CNS and we can't fix it, it gets removed and we replace it with astrocytes. And because of their feet and they grab onto things, they kind of help hold things together. They also have the ability to convert glucose, which is sugar, to lactate, which is the form the neurons use for energy. And lastly, they will absorb excess neurotransmitter. So if somewhere we're secreting more neurotransmitter than necessary, some of that will get reabsorbed back into the neuron, the synaptic knobs, and some actually gets even absorbed up into these astrocytes. We've got a third type of neuroglial cell. It's called an ependymal cell. And what it does is it lines those cavities. I mentioned what they were called. They're called ventricles. Okay? And they help to produce cerebrospinal fluid. That's what CSF stands for. And they have little cilia that beat a certain direction, and they move the cerebrospinal fluid through these channels kind of in a pattern through the brain, so it washes in and around the brain and the spinal cord. And the cerebrospinal fluid has its own function, but one of it's to rinse away wastes and that type of thing. So this ependymal cells help to produce it and then help to circulate it, so we don't want it to be stagnant. And then the last one is called a microglial cell. It's used to be a monocyte. It's a little bit fancier. And so monocytes are phagocytic cells, microglial cells are phagocytic cells, and they tend to make their way through the nervous tissue and they look for things that don't belong. Okay? So if you were a pathologist, and let's say you were doing a slide of a deceased person's brain, they sent it to you, they're trying to figure out what happened, you would see these at any site of infection or trauma or that type of thing. Okay? So that's one of the ways they know maybe what happened or where the problem was. Because it's going to phagocytize any dead cells. So it says there if they had a stroke. So if somebody has a stroke, they've cut off blood supply to the brain tissue, the neurons there, and they die. All right. So to get rid of them, the microglial cells come in and phagocytize them, kind of like Pac-Man, gobbling them up, eating them, and then they're going to replace it with astrocytes. So if they sent that slide, that section, or the pathologist looked at that, they'd see those there and they'd realize, okay, this fits the signs and symptoms. They probably had a stroke. Here's kind of some drawings to try to give you an idea of what they look like. This right here is our oligodendrocyte, and its arms come off and wrap around the axon in different places and form the myelin sheaths. Okay? Here's our astrocyte with its little feet that are going to wrap around and kind of suction onto things and seal them off. And this is a blood vessel capillary. So imagine thousands of these all in this area, and their feet are all wrapping around there. It's going to seal off that blood vessel pretty well. Here's the ependymal cells. They produce the cerebrospinal fluid into some sort of cavity, and then they have these little cilia that move the cerebrospinal fluid one direction or the other. And then this is a microglial cell that's going through phagocytizing and destroying things that don't belong. Here's a little more cluttered picture to give you a little better idea. You can see how this blood vessel here has been totally sealed off by the perivascular feet of the astrocyte. Peri means of the vascular blood supply, so these are feet that like to seal off the blood supply. Here's your oligodendrocyte again, forming the myelin sheaths on the axons, your ependymal cells, and then a little microglial cell. So if I pointed to this and asked you what it is, what would you say? Astrocyte, very good. How about this one? Ependymal cell, this one, microglial, and then this one's got the answer there. It makes it always very easy. Okay. Just see if you remember, because you got your test coming up, what type of neuron is this based on its structure? How many things are coming off the nucleus? One, so that would be a unipolar. Good. All right. Which are the following responsible for myelin sheaths in the peripheral nervous system? The astrocytes, the satellite cells, the ependymal cells, oligodendrocytes, or Schwann cells? Number 4? How many like number 4? No. Peripheral nervous system, Schwann cell. See? It's tricky. He didn't read the question carefully, and that makes it tricky. Okay? All right, so the meninges, and we did talk about the meninges. What are the 3 layers of the meninges we saw on the spinal cord? Dura mater, pia mater, and arachnoid mater. Good. It's going to be the same. Okay? There's a little change, but it's the same layers. So see? One's kind of fitting into the other. Dura mater was the outermost layer, right? Meant tough mother. It's a tough outer fibrous membrane. Now, here's where it's different. In the spinal cord, it had 1 layer. Okay? It was called the meningeal layer of the dura. In fact, they didn't even differentiate. They said it's the dura mater. Okay? And that left then an epidural space, a space between the dura and the bone that was filled with fat. Fat's a loose connective tissue, very vascular. Okay? In the brain, this dura mater has 2 layers. It has that same layer that it had before. They call it the meningeal layer. And it has a periosteal layer. Periosteal tells us what? Of the bone. So it adheres to the bone. So that means there's no space between the bone and the dura. So there's no epidural space in the brain, okay, where there is in the spinal cord. That's really the only difference. So we have an outer periosteal layer, an inner meningeal layer, and in between the two, there's a space, and it's where we have dural venous sinuses running. Okay? Now, a sinus, when they're referring to the blood supply, or to the vasculature, I shouldn't say blood supply, vasculature, vessels have a layer of smooth muscle. Okay? That smooth muscle can contract, can dilate, it can change the shape of the vessel. Sinuses are vessels without any smooth muscle, so they can't change their shape. They're just kind of a flaccid sac that can be filled up with blood, or flaccid tube, how's that? Okay. In the spinal cord, we had some accessory structures, and those accessory structures came off of what layer? The pia mater? Do you remember what they were? All right, we haven't really studied for this test yet. I can see the review game is going to go splendidly. No? But remember, how did we anchor the spinal cord so it didn't move around and bang into stuff? Not the tendons, but you're getting there. Not tendons, think of something else. They had what are called denticulate ligaments that anchored the spinal cord to the vertebrae, and then they had one going all the way down, straight down, like I talked about anchoring something that was hanging from the ceiling. This went all the way down, went through the sacral canal, at the sacral hiatus, became the coccygeal ligament. So the denticulate ligaments, and we had filum terminale, All right, so I will tell you that the test on Tuesday will go much better when you study. It just seems scientific surveys have shown that. All right, arachnoid matter. Arachnoid meant spider. It's a filamentous layer. All right. Nothing new with it. And then we have still the pia mater, thin vascular layer that adheres to the contours of the brain. You guys are doing your practical this week. Next week, I think we look at sheep brains or whatever, and you'll see the ridges and depressions in the brain. This pia mater goes down into those crevices. Okay, they're called sulci. So we'll see that next week. So here's kind of a picture. They've taken a skull and they pulled out a section here. Okay, blown it up so we can see it. So here's the brain. Here's the outer layer. This is the skull. This purple layer here that adheres to the curves of the vessel. So these little grooves here, they go down in the grooves. That's the pia mater. The light blue is the arachnoid matter, and they're trying to show little filaments coming off of there. And then here is the dura mater. And there's two parts. There's a periosteal. You see how this one's tightly adheres to the bone itself? And then the meningeal layer. And in between here, this is a blood vessel running this direction. Okay? So blood will move through there. Okay? There's a subdural space, a space below the dura, between the dura and the arachnoid matter. Have you ever heard of subdural for anything? Is there a problem that somebody could have subdural hematoma? Okay. Basically, blood starts to pool there. It puts pressure on the brain, cuts that portion of the brain off from its blood supply, and then that portion of the brain will die. So they have to relieve that pressure. There's a subarachnoid space. So it's a space between the arachnoid and the pia, and that's where cerebrospinal fluid will flow around the brain. Okay. Here's just a different view, because we have, I didn't even go over that. I skipped over. The accessory structures are where they were for the spinal cord. They were off the pia. These are off of the dura mater. Okay, and there's three of them. We have falx cerebri, falx cerebelli, and tentorium cerebelli. Okay, and they're connective tissue, thick connective tissue, because they're part of the dura. The falx cerebri and falx cerebelli divide. Cerebri divides the two halves of the cerebrum. The cerebelli divides the cerebellum into two left and right halves. And then tentorium cerebelli divides the cerebellum from the cerebrum, which you may not know what those areas are, but I'll show you on this picture that's coming up. Okay, so we go to this picture. This whole thing with the brain that would be here. Okay, let's go back. This is cerebrum. This is cerebrum. Going down in here, we're going to have falx cerebri. Divides these two into left and right halves. Okay. Here it is. This white sheet right here, falx cerebri. We have a very small one right here dividing what was the cerebellum, another portion of the brain, into right and left halves, falx cerebelli. Okay? And then this portion here divides the cerebrum that's up here and the cerebellum. Keeps them separate. That's tentorium cerebelli. Now, what you see here, these are those sinuses. Okay? I called them dural venous sinuses because I'm just basically saying blood vessels that can't change their shape that are running through the dura. There are specific ones. We have a superior sagittal sinus. We have an inferior sagittal sinus. You don't have to worry about those terms per se. They're just blood vessels running. This would be running deep between the right and left sides of the cerebrum, and this would be up closer to the surface. So pathology. First one, meningitis. We've heard of meningitis. Okay, who usually gets meningitis? Old people, young people, men, women, children. There we go. There we go. All right, so serious condition, children ages 3 to 24 years old. Okay, and so itis means an inflammation due to infection of the meninges, typically the pia mater or the arachnoid matter, okay, the layers closest to the brain. These pathogens usually get in with children in through their nose, through a sinus infection, and then somehow move across or get to the meninges. The problem is if those meninges swell up, it's just like having a subdural hematoma. There's pressure on the brain. Okay? It's also kind of difficult to treat because we mentioned that blood-brain barrier. Not just any antibiotics will cross over that and fight that infection. So they have to give them specific things. So it leads to brain swelling. Brain swelling can kill the brain, and then that can lead to death, and it can do it within hours. And like I didn't say it yet, but the issue with that is you're talking 3 to 24 months old. Okay, when do babies generally start talking? Yeah, about 2 years, so close to that 24 months. So they can't articulate what's going on. So all they do when they're sick is cry. Okay, so if their stomach hurts, they cry. If they have a headache, they cry. It's hard to tell. And these signs and symptoms are just that of being sick. Okay, they have a high fever. Okay, stiff neck. Now, is the baby going to say, my neck's stiff? No. You're going to have to notice that when you move the baby's head or the baby moves its head, that aggravates things. Okay, the baby's head hurts. They tend to be drowsy, sluggish. Okay, it can even hurt them bad enough that they'll be vomiting. All right, the high fever. Usually fevers below about 102 with small children are not a big deal. You start getting up around over 103 to 104 range, that's a big deal. That's when you want to get them somewhere and get them there quickly. Okay, because the thought is that your immune system's developing, so them being sick isn't so bad. It's how their body kind of learns. So usually below that, you just kind of shrug it off, and it sucks for them. But you could see if you weren't paying attention, and maybe you took the baby's temperature and it was 102, and you just assumed that. You didn't check it a couple hours later and saw that it was elevated, and just kind of like shut it off in a room because you were trying to get your own sleep, that something very bad could happen. It's diagnostic. They'll pull some cerebral spinal fluid. They'll do a LP, a lumbar puncture. They have to do that below what level on the lumbar? Well, you want to be below L3, right? Because L3 is where it ends. Spinal cord ends in children, so you're going to do L4, L5, L5, S1. They'll make sure they go low. Pull the cerebral spinal fluid out and look for evidence of the infection. Okay. Meningeal spaces. So I mentioned some of these. We have an epidural space. Do we have that in the brain, or do we have that in the spinal cord, or both? In the spinal cord only, okay? Because in the brain we had that periosteal layer of the dura. So there's an epidural space sometimes. It's only in the spinal cavity between the dura mater and the bone. Subdural space means it's below the dura mater, so that means it's between the dura and the arachnoid, and the subarachnoid space between the arachnoid and the pia. We can have the bleed, like I mentioned, the subdural hematoma. In that subdural space, that can be problematic. And the subarachnoid space, we have cerebral spinal fluid. So, this is just to show those. Let's move to the next one. Okay, so here, they've taken a piece of the skull, broke it off, and blown it up for us. So this is what we're looking at. So this is part of, say, the parietal bone. This is dura mater. This is that periosteal layer that adheres to the bone. Here's the meningeal layer of the dura, and in between there, we find what? Blood vessels that can't change their shape. That's where we find the dural venous sinuses. This one being specifically, they might call it the superior sagittal sinus. Then between the bottom layer of the dura and the arachnoid layer, this black line here is the subdural space. This is the arachnoid matter with its little filamentous things coming off, supposed to look like a spider web. These spaces in here are part of the subarachnoid space where we find cerebral spinal fluid. And then here's the pia mater adhering to the brain itself. Okay? All right, so that takes us to ventricles and cerebral spinal fluid. I just want to see how big this unit is. I think we can stop there for today.